طيب بسم الله الرحمن الرحيم. My name is Dr. Ibrahim Kamil Luttfi, medical education specialist working as supervisor and trainer in home health care of in Kingdom Saudi Arabia. My published paper talking about the effect of training program on improving the knowledge and skill of the nurses in home health care in Riyadh region 2018. Outlines, introduction, objective, material and methods, result, discussion, conclusion, and recommendation. Introduction. Working with elderly people at their homes is very challenging, and health workers can have a significant impact on their patient. No study have been published that describe the effect of the training program for this staff group in Riyadh region, Kingdom of Saudi Arabia. Why this topic was selected? To assess the impact of training on home healthcare nurses, because there are no relevant studies. Monitoring of skills and knowledge is essential to identify deficiency and provide background for the development of home healthcare program. Objective. General objective: to study the effect of training program on improving knowledge and skills of the nurses in home healthcare in Riyadh region 2018. Specific objective: to identify the deficiency and competency need of the nurses related to home health care, to design and conduct the home health training program, to assess the impact of training after attending workshop, lecture, and on-the-job training in improving their knowledge and skill in home health care through assessing the knowledge and practice score before and after training program. Material and methods. Study the design as a quasi-experimental pre and post intervention. Study area, Riyadh City, Kingdom of Saudi Arabia. Study population, 50 nurses working in Saudi Arabia. Data collection by both questionnaire sheet for pre-test and post-test for nurses' knowledge and skills. Data management by using SPSS program version 21. Also use some statistical analysis such as chi-square, test percent tables, and t-test. Results. The result of pre and post test of the nurses' knowledge. The result of the nurses' knowledge show that nurses improving their knowledge and after attending a training program. Also, they show that remarkable increment in the knowledge, especially in two parts: assessment of the patient and safety of the patient in the home. Result of pre and post test of the nurses' skills. The result of the skills of the nurses show that nurses improve their skills after attending a training program. Also, they show a remarkable increment in the skills, especially in the three skills: monitoring temperature, monitoring pulse, and monitoring respiration. Discussion. According to the finding derived from 5 parts of the knowledge, the significant for the comparison of the score for knowledge pre and post test is significant p-value equal 0. The result of 5 parts of the knowledge show that nurses improve their knowledge after attending training, workshop, lecture, and on-job training. The result mentioned agree with Dr. Hale Said and Zahra study. The result of 10 skills, the significance for the comparison of score for pre and post test is significant p-value. The result mentioned agree with Shigri study and Kyoko study and other study. Conclusion. Training can facilitate occupational tasks and achieve greater mastery of professional skills among nurses. After attending a training program related to home health care in Riyadh, Saudi Arabia, there was a remarkable increasement in knowledge and skills means of the post questionnaire sheet. It can be conducting the nurse improving their knowledge and skill after attending a training workshop, lecture, and on-job training program. Empowering education is a new model for in-service training of the nurses, which marks the training program with androgyny needs of the learning among the staff. Finding from the study revealed that professional on the job training is expressed need and expectation of the nurse across all career stages. Ongoing training, education, and professional development facilitate a transition to practice for nurses and also help to ensure competency and quality patient care throughout the span of the nurse's career. Also support career development, fulfill of the nurse's need for growth and acquiring new skills and knowledge to cope up with future work in home health care. Recommendation: conducting similar research on a wide scale to determine the impact of training based on a diversity of new teaching and training methods. Continuing training calls for nurses to become more professional and improve their skills and knowledge about home health care. There should be a basic assessment of the nursing to disclose the training need for focusing on when conducting the training session. Nurses should be encouraged to upgrade their English language learning because some difference in nursing level were observed in this aspect. Thank you very much.